Good morning, dear friends, distinguished delegates, and dear colleagues. It is my great pleasure to welcoming you. I asked the colleagues to sound the chime, and everything felt very, very silent. I didn't want it to be so radical, but it is a bit time to start also because this event will be followed by another important event, and we have promised to be really, really on time and in case continue our discussions elsewhere. But let me, while I keep on talking to give you the time to sit down, let me start by not only welcoming you, but presenting myself. My name is Giovanna Campello. I'm the chief of the Prevention, Treatment and Rehabilitation section here at UNODC. And I would like to welcome you to what is by now the third briefing that we have organized on our CHAMPS initiative. If a little small exercise of memory, our two previous meetings were in October 2023, and this February in 2024, we had the formal launch of the initiative during CND in March 2024 during the high-level ministerial segment. So for us, this is an opportunity to thank all of the governments of their supports in general, of prevention in plenary, also during the Pledge for Action. And we want to update you about what has been happening with the CHAMPS initiative in these past few months, and hopefully provide you with inspiration and to the many governments that have decided to join, a confirmation that this is a transformative initiative for prevention and for children, and to the member states that maybe have not been able to join, but to appreciate the kind of work and possibly support in various ways. We have a bit of a packed program. We will have, of course, some opening remarks. We are graced by the presence of the chief of our branch and Vadi, who leads all of our program of work on prevention, but and especially, of course, what is our flagship initiative, which is CHAMPS, will provide you with an update. But above all, we will hear from you, from yourself, from the member states that are connected to the initiative one way or another, and would like to share their experience so far. We will have a little bit of time for discussion, maybe interventions from the floor. As I said, we might need to be a bit strict with the timing because we are followed by an important event the other colleagues have worked very hard at, and I know it's dear to everybody's heart since it is the first time that we are commemorating the day against organized crime. But there will be, of course, other opportunities to connect. At this point, of this just short overall introduction, I have nothing left to say, but to move to the actual program and request the kind intervention of Justice Tetti. You know him all. Everyone knows him, but let me introduce him. He is, of course, the chief of the Drugs Laboratory and Scientific Services branch, to which the Prevention, Treatment and Rehabilitation section belongs. And I would like to give him the floor for some opening remarks. Justice, the floor is yours.
Thank you very much, Giovanna. Excellencies, ladies and gentlemen, champions, good morning. I'd like to start my words by drawing your attention to that child's face. That smile. A child's smile is the most precious gift in the world, a reminder of the purest joys of life. But drugs, violence, conflicts, trauma are all things which can snatch the smile away and take away all the joys. I believe we owe it to the child one of the most vulnerable members of society, to make this smile remind all of us of what we used to be years ago and what we all hope for. Ladies and gentlemen, we ended 2023 with an initial brief on CHAMPS as a concept. We started 2024 with a second briefing presenting to you CHAMPS in an advanced designed framework. And this briefing came with a plea to you as member states as we approach the high-level midterm review meeting of the CND in March 2024 to prioritize prevention. We're very cognizant of your responses to this plea, a clear support reflected in plenary statements and in pledges for action, placing prevention as a priority on the drugs agenda. CHAMPS was launched in March 2024 during this high-level review, together with member states supporting this initiative massively. In the few months between March and today, our vision for CHAMPS is starting to materialize. As this is rolling out, we thought it would be great to have this briefing to update you on the longer-term vision of the importance of this initiative, which we are embarking on. CHAMPS aims at building preventive systems or prevention systems. Systems capitalizing on the symbiotic links that exist across prevention of crime, community violence, violence against children, violent extremism, terrorism, corruption, and more. And when you look at the wide range of areas, in order to deliver efficiently, we need to break silos. This is where we applaud Brazil, for instance, for reflecting on the strategy aiming at protecting children from drug use, violence, and crime. A child-focused strategy placing CHAMPS as the arm articulating its prevention component. Colleagues, breaking silos also means unifying the approach that addresses the root causes of drugs and violence and strengthens resilience, recognizing the interlinkages between drug policy, security, and social stability. This is reflected in the CHAMPS system being set up in Egypt, benefiting communities in newly established areas developed as alternatives to previous slums. The Egyptian CHAMPS system will be an articulation of the prevention component of their recently launched national drug strategy, an approach integrating diverse governmental and non-governmental entities supporting children development in this alternative to the slum environment. Colleagues, we're looking at a system where UN agencies, as well as UNICEF, WHO, UNFPA country offices, are joining UNODC, hand in hand, to deliver on CHAMPS. This is a clear example of joint programming under the UN Common Position on Drugs, starting with prevention. These are a few of many other examples being considered. This morning, you'll get to hear more from the presentations coming. Reflecting on last year's CND and the impactful pledge for action, we acknowledge and appreciate the commitment demonstrated through the pledges presented by member states. These pledges have already catalyzed meaningful actions and developments across various areas, especially for prevention. Today, these efforts are laying the groundwork for a more cohesive, responsive, and effective global response to drugs and drug policy landscape. Colleagues, it all started with a resolution. With your support, we translated words into action, and CHAMPS was born. It started with a resolution that was adopted by the CND in 2022, specifically Resolution 65/4, a landmark resolution prioritizing prevention at early stages of development. a resolution reflecting a strong consensus among member states when it comes to protecting children from drugs, despite the tense political spirit at the time. And we thank the government of Slovenia for your leadership on this. Colleagues, let's renew this important political commitment with resolutions, if possible, on prevention in 2025. Let's sustain this momentum on protecting children and our future generation from the harms of drugs. This shared commitment reinforces our ongoing efforts and further gives hope to the spirit and value of multilateralism to support healthy and safe development of children. A spirit driven by the smile on the faces of children. In a matter of a few months after its launch, CHAMPS has garnered immense support and is currently being implemented at various stages in different countries. We do have a longer list of CHAMPS countries to announce shortly. Countries from Africa, from Latin America, from Europe, and from Asia that are formalizing their commitment. This progress is encouraging as it demonstrates a growing global commitment to early prevention within a systematic approach. We welcome and encourage further expansion in the coming months. As more nations get on board, we look forward to a stronger, more unified global effort that can make a lasting impact on drug prevention and contribute to the well-being of children and communities worldwide. Let us come together around prevention for our children. Let us showcase that prevention as a system is effective and can generate a large return on investment in the health and welfare of our community and our planet. Let us all champion CHAMPS. I thank you.
Thank you so much, Justice. And what I take from, especially to heart from your opening remarks, is the fact that we all know that if you do evidence-based prevention according to the standards, you do so much more than preventing drug use. You're really taking charge of the well-being of people, and what we have found out is that this small idea that we have, we want to move from small programs to the transformative change of system, really brought everybody together. Like you were mentioning, member states, international organization, governmental and non-governmental agency, academic, of course, institution, and so much more. And I'm really looking forward to see this collaboration flourish. And to start us with knowing what's happening, I would like to give the floor to my dear colleague and friend, Wadia Malouf. He is, as I mentioned before, the coordinator of all of our program of work on prevention of drug use and other risky behaviors, and he will walk us through the progress so far. Wadia, you have the floor.
Thank you very much, Giovanna, and thank you as well for your guidance on this, and you too, Justice. And while the slides are uploading, I take the opportunity to give a smaller brief on what CHAMPS is, and maybe a bit longer as an update on where we stand, but recognizing the fact that there has been changes in the permanent missions here. I will showcase during my presentation where previous briefings are uploaded, and just to let you know as well that this one also will be uploaded should you want to use this to brief also your capitals in terms of latest updates. So CHAMPS is, again, a Children Amplified Prevention Services. I'm trying to move the slides, but yeah. So the uniqueness of CHAMPS is a key component that kind of features it among other programs that we do have in prevention, because this is a program where model countries will have to demonstrate the effect of prevention, but not on a sectoral level within a program of prevention, but more coming in as a multi-sectoral approach, showcasing that prevention can make a difference on scale. So while we are continuing our efforts in terms of guidance and producing standards and further guidance within every single sector, as well as providing specific tools of prevention that specific sectors can provide, including the most recent one that we're doing, for example, for youth themselves to provide prevention and will be implicated in CHAMPS, like Friends in Focus. We will now showcase that when programs come together as different sectors and better coordination happens, a change can happen at scale, not within the actual value of the original program as it is designed. Let's assume a program was designed by the Ministry of Education to improve educational retention in schools or attachment to the school system or improving the school climate, how that program within the school could affect the strategy on drugs, the mental health strategy, the violence against children, and beyond. So every sector will have an added value beyond the original value of the program that they have, which is a key feature in terms of changing the way we're doing programming and actually showcasing work beyond the scope of the value of the research that we originally found in the prevention standard documented by evidence. Generate more evidence and more research on sectoral interventions that are key, but also on systems and how systems can happen together could showcase a better way of doing investment, a return on investment, and beyond. So this shift of paradigm is key, and this shift of paradigm echoes the call that you were doing as member state to ensure that within such system, no child is left behind in terms of benefiting moving forward. So we will also facilitate that exchange of expertise between each other. If we move to the next slide, so this is in a nutshell how the system would look like. Okay, there was an on button that was missing. So, and this is where I will not go into detail, but previous briefings that you will see online will go into this process. But just to refresh your memory that we're talking about every single age of development has specific milestones to be attained, and there are children at different level of needs. They will see them in green, in yellow, and in red. Green meaning any child at a specific age can benefit from a certain intervention. Children that require living in circumstances that are higher vulnerability than other, in yellow, and children that have specific symptoms and a specific age group that requires attention that's individualized could benefit from these interventions. So the prevention standards that we have with WHO will provide what is needed, but the mapping of what exists within your resources will be done through this REPS model that is there to really capitalize on infrastructure that have not been accounted for before such systematic approach and build on it together with tools that are now existing to support you and their low cost to fill in any gap, leaving no child behind. So these programs provide a lot of partnership opportunities between sectors, between the private and public sector, with the civil society sector that we will hear from, and also the academic sector to be implicated in researching new innovative ways of doing work, researching ecological changes that happen by investing as a sector, and not only researching a specific intervention. It will not replace it, but will add to the value of researching a specific intervention and its effect. So this merging of effort is key, and as Justice mentioned in an opening remark, it's an opportunity also for us as UN agencies to come together and reflect our work jointly. So there will be multiple waves of action moving forward. We will recognize some of the member states that are here, but there will be much more coming up. We have two sets of member states that are joining such initiatives. We have member states that are putting themselves in as CHAMPS country. They want to put CHAMPS within their systems. And we have groups of countries that supporting CHAMPS as an initiative in terms of its global value moving forward and availing that, supporting UNODC in its technical assistance to help these countries that want to do CHAMPS, put it in place. And these two groups, by the way, in many instances overlap. So it's not two exclusive clubs, but clubs that could be supporting the infrastructure to help others. So this is a key feature of CHAMPS that we would like to capitalize on. Our first wave is a key wave, and that's why we are very keen in terms of ensuring we have geographical diversity that you will see in terms of countries that are coming in, but does not mean that that's the only wave of countries that's in. We invite you to have as many interest as possible. We will have repeated waves coming in, but the first wave of countries for us is a determinant one because you will see that the implementation is a 5-year implementation of system to document the experiences. This will coincide with the 2029 final review of the political declaration. It will coincide with the SDG 2030 as well. So we will have demonstrative countries showcasing the value of investment or prevention, but of course any other wave would have something to feed into it. So where are we? This initiative went a long way quite rapidly. So after the launch that we've done in terms of, it went from designing in May 2023 to briefing you in terms of how it's being designed, to listen from you, as well as also we have went through the process within the UNODC to see how we can conceptualize it. We conceptualized it, and then we shared another briefing with you prior to CND towards October 2023. That was the first briefing. The second briefing was in February 2024, and then the launch was done in March 2024. So during the process, during 2024, we immediately started getting not-verbals from you engaging in action. And we have different processes. Certain governments came in and said, like, you know, there is interest in terms of we're doing a strategy, for example, in Brazil, on protecting children from drugs, crime, and articulating CHAMPS, and that formal engagement will be done through that strategy. There are countries coming in saying, like, we have a strategy in place and we want to demonstrate through that strategy on the ground how CHAMPS can benefit that strategy. That's the case of Egypt. We have a longer list of countries that we're following up with in terms of understanding how they can formalize this arrangement moving forward. And this is where we moved from the launch in March 2024 to addressing questions, engaging with you, those interested, and formalizing this agreement on the ground that you will hear from the countries. That process in terms of articulating on the ground was also a learning experience for us, because while the concept is there, when you put the rubber to the road, as they say, we start realizing, the variety of questions. So now we have a better way of addressing and answering all of these questions. But between now and CND and within 2025, we are at the process, for example, of engaging with Algeria to, given their commitment to set up the processes, but we have a longer list of countries, as mentioned, that we're trying to respond to and formalize it. So this articulation now that's on the ground moved our discussion that we had in the very beginning in-house of how to conceptualize this program to a discussion of Egypt is already setting up CHAMPS. How can we bring different parties of the house as a steering group and really benefit jointly around one population? The different prevention initiative may be a prevention of violence, prevention of crime, prevention of corruption, prevention of violence against children. All of these elements that have a common integration, how can we come and service it moving forward? This is where we are. We're setting up these systems by working with you nationally and working within house to see how we can support you. So further to the information that we have some breaking news that just a couple of hours ago, the National Council for Drug Control in Uzbekistan that was launching their strategy 2024-2028 have discussed their work plan that was approved on presidential level. And within that work plan that is from until the end of 2025, prioritized CHAMPS as an initiative moving forward. So we're looking forward to meet with the NCDC next week and discuss how we can help them moving forward. So as you see, there are diverse countries moving in, and as mentioned at the beginning, if you want to hear more about the experiences of Brazil and Egypt, we have two news stories that are online, but you will hear it from the mouth of the delegations that are here. These are just QR codes that will be with you to get to these documentations. Another important piece of information for us is the fact that the website is now hosting a lot of information that can address some of the questions you have in mind. And that website is currently available in English and in Arabic. And very shortly, that website will be in Spanish as well. So this diversity as well, because we are sure there's a lot of questions. But the website also, as I said, have these briefings. And there's a lot of questions that are answered within the discussions that we're having. So children are at the center of all the responses that we're moving forward in terms of building systems of coordination. And I probably, for the sake of time, I will end it here to more have a discussion of what CHAMPS is about. Just make sure. But with a note of feel free to contact us anytime. There's no wrong door to knock when it comes to answering questions on CHAMPS. We're here at your service. And Giovanna, I'll pass the floor back to you, and just in case also I might have forgot something.
You haven't, and I think that this gave us a very good sense of where we are, and has set the stage for maybe the most important characters in this event today, which is our fellow member states that have, in different ways, decided to join this initiative and would like to share their experiences. So I have a small list in rigorous alphabetical order by English language. So I would like to give, first of all, the floor to Algeria to share their interest and connection to CHAMPS. The floor is all yours. Thank you so much.
Thank you very much, Giovanna. Thank you, Justice. Thank you, Wadia, for this briefing. And thank you for this opportunity to deliver short remarks on our interest to serve as a pathfinding country and one of the model of implementation of this flagship initiative. So our interest for CHAMPS draws its source from the shift in our national approach aiming at addressing drug demand, which is now more focused on prevention, treatment, and rehabilitation. In this regard, Algeria adopted in May 2023 new legislation that gives priority to prevention and treatment over criminal justice sanctions. In the same vein, Algeria also pledged during the 67th session of the CND to establish 4 new modern addiction treatment and rehabilitation centers. In this new national approach, reducing drug among children and young adults constitutes a top priority. In fact, data show that adolescents and aged between 12 to 17 years old are today more exposed to drug use than by the past. So we feel this need to scale up our national preventive measures directed toward this young population, including by integrating the innovative tools of CHAMPS. At this first stage of our engagement in the initiative, I would like just to share briefly our initial expectations. So because we didn't yet start, so it's more about expectations. And first of these expectations is we'd like to have a clear overview of the efficiency of our preventive programs that are already implemented in our national level. So concretely, we are looking forward to benefiting from the expertise of UNODC to help us assessing the national programs and to provide us with tools that allow us to conduct periodic evaluations. Second, we have the diversity of governmental and non-governmental entities that conduct sectorial programs. Often there is lack of coordination between these different stakeholders. So therefore, we are very much interested in the systematic approach that CHAMPS is advocating. And we hope that we will receive assistance to build preventive system that improve the existing programs and combine also them in a synergic way. So third, the preventive programs in Algeria are mainly focused on the substances. So, and it takes generally the form of awareness raising campaigns. Since it is clear that initiation of drug use is not necessarily the result of lack of knowledge on the danger of the substances. We are very much interested by integrating the new preventive tools proposed by CHAMPS, which are aiming at addressing vulnerabilities and amplifying children's resilience. And fourth, since the implementation of the preventive intervention is carried out at the local level, we are facing a lack of qualified and well-trained stakeholders, hence our need for the capacity building dimension of CHAMPS. I can also underline other aspects in CHAMPS that encouraged us to join the initiative, such as the integration of digital elements, which is in line with our national priorities. In addition to the fact that CHAMPS tools are already available and could be easily adapted to our national circumstances. In conclusion, I would like to encourage other countries to step up and join CHAMPS. We hope also that more government and non-governmental actors will join in championing this creative initiative and help the UNODC in the process of its implementation. Thank you very much for your kind attention. Thank you.
Thank you so much, Algeria, for sharing so clearly not only your expectations, but also your commitment. And I would like to underline that CHAMPS is a true partnership. And all of the countries that are joining are really committing themselves to work together with us to expand their system, like you were just mentioning. And thank you for illustrating it so nicely as our first intervention. But now let me move to our second intervention, and may I call on the distinguished representative of Brazil to share with us their experience, although I understand that the intervention is in fact online.
Good morning, everyone. Can you listen to me?
Sorry, yes, we hear you very, very nicely. We don't see you, but we hear you nicely. There you are. Hello, Nara. Very nice to see you.
Hello, everybody. Good morning. Thank you very much for the invitation to be here and sharing our perspective of engagement in CHAMPS. It's been now more than a decade since the Brazilian government decided to implement its national drug use prevention policy on an evidence-based perspective. See, we are now focused on human-centered approaches, considering not only the scientific evidence, but also territorial and cultural needs. What is particularly a challenge to a country with the dimensions of Brazil, and working on strengthening the protective factors and reducing the risk factors for both drug use prevention and violence and crime prevention. Currently, as an advocacy strategy in the field of prevention, the Brazilian government offers training for decision makers and prevention practitioners based on a worldwide recognized prevention curricula. Aiming to promote amplified prevention paradigm, the Ministry of Justice is investing into the dissemination of prevention programs based on evidence-based, and addressing schools, communities, and families, providing training, guidance material, and monitoring through partnerships with our federative units in all regions of the country. We already have national data on these programs, and evidence on their effectiveness in reducing both the risks of problematic substance use as well as the exposure of target populations to vulnerabilities. Within a comprehensive perspective of the prevention component of the Brazilian drug policy, we are also implementing a program called Pronasce Juventude, that is Youth Pronasce, addressing homicide prevention and promotion to social protection with a focus on Black young population living in peripheral territories of cities such as Rio de Janeiro and Salvador that are disproportionately affected by drug trafficking activities. With our engagement in CHAMPS, we are now going to take one more step forward in integrating comprehensive prevention actions and services into local model systems. We were especially encouraged engaging CHAMPS because of the perspective of amplified prevention contribution to both drug-related outcomes and violence and crime outcomes that are totally aligned with the current perspective of our drug policy. And also the possibility of strengthening multi-sector cooperation and empowerment of local services, and also the qualification of local prevention interventions and public policies decision makers based on scientific evidence. As for short-term outcomes of CHAMPS implementation in Brazil, we expect the engagement of other sectoral policies such as health, education, human rights, and social protection in increasing of the public investment in prevention targeting children. We also expect a networking of Brazilian experience in systems of prevention with other countries on a South-South collaboration perspective that is of much of our interest in terms of cooperation, and also the possibility of better targeting the sustainable development goals and ensuring health and safe development of our children. In this way, we would like to encourage other countries to follow us in engaging on CHAMPS models of multi-sector systems of prevention, documenting change in the lives of children. Thank you very much.
Thank you so very much, distinguished delegate from Brazil, and also for joining us from so far away. Small piece of trivia. Brazil is the first country, and I'm talking quite some time ago, that came to us and said, we want to work across sectors. And for a long time, we could only support family and schools. As you have seen from Vadi's presentation, in the meantime, we have been able to develop a much larger and much more comprehensive set of tools that are at the disposal of everybody, but we are hoping will work very well in an integrated manner in the implementation of CHAMPS. So thank you very much again, and now it's my pleasure to give the floor to our distinguished colleague from the delegation of Egypt. Please, the floor is yours.
Thank you, and allow me at the outset to express my appreciation to the UNODC for organizing this briefing on the progress achieved in the implementation of the UNODC Children Amplified Prevention Services Initiative. Since the initial promotion of the initiative, Egypt recognizes the importance of CHAMPS and its adherence to the Egyptian strategy and policies addressing the drug problem. Last October, Dr. Maya Morsi, Minister of Social Solidarity and Chairman of the Board of Directors of the Fund of Combating and Treating Addiction and Abuse in Egypt, and Dr. Ghadawari, the Executive Director of the United Nations Office on Drugs and Crime, officially launched CHAMPS in Egypt. We are so proud of being the first country to put the initiative in gear. Dear colleagues, I'm honored also to share with you Egypt's vision pertaining to joining CHAMPS and the way forward. CHAMPS as an integrated prevention model system which aims to enhance children's resilience from birth to adolescence aligns with the Egyptian drug control strategy and action plan for drug demand reduction during the period from 2024 to 2028, which is based on prevention and centered around the protection of child to attain a society free of drug abuse. Egypt has succeeded in developing several evidence-based prevention interventions in diverse sectors and contexts at schools, media, family level, among others. However, we are convinced that prevention programs are impactful when they involve all relevant sectors with a strong monitoring and evaluation component. In that sense, CHAMPS will support Egypt to orchestrate all these programs through building a comprehensive and amplified multi-sectorial system for prevention interventions based on scientific evidence responding to the needs of the community. The first phase of the initiative is being implemented in alternative housing areas, replacing slums, which represent one of the state's significant projects that invest in people and enhance their qualities and capacities. The model prevention system will provide all children from birth till age of 18 years old with an integrated set of services, protecting them against all vulnerabilities they are exposed to, not only drugs, but also violence, extremism, risk of exploitation by organized crime groups, among others. The philosophy behind selecting this geographic area is to guarantee that alternative housing areas come with an overall improved living conditions, and that community offers children broader horizons for a brighter future, with the aim to enhance investment in the development of human capital in a new sustainable community and ensure a healthy and safe environment for the development of children. Egypt's Fund for Drug Control and Treatment of Addiction has entrenched comprehensive drug demand reduction programs in these areas since 2020 for prevention, treatment, rehabilitation, and social reintegration, with a wide network of volunteers and civil society. This new model will be implemented for 5 years in multi-phase approach, with UNODC support in providing technical guidance on CHAMPS system implementation, including the conduct of a primary review of prevention systems, mapping out the existing infrastructure and the development of a situation assessment study on substance use, particularly among children, as well as capacity building programs on UNODC WHO prevention standards to strengthen the comprehensiveness of the response and to ensure that it's based on scientific evidence. The UNODC will also support Egyptian authorities in the evaluation and follow-up process with focus on lessons learned. In conclusion, I would like to express deep appreciation for the UNODC for this constructive cooperation. We look forward to witnessing the replication of the initiative in different parts of Egypt and the world, which considers as a milestone for collective efforts towards addressing the threat of drug abuse and therefore bridging the gap of views and stances on the way forward to counter the world drug problem. Thank you.
Thank you, distinguished delegate of Egypt, for not only sharing your experience, but on behalf of sharing on behalf of your government the commitment to creating something new. And what I particularly appreciated was the underlining of how evidence-based prevention really is able, based on science, to recognize the influence of socioeconomic marginalization and address it for the better development of communities, children, youth, and their families, of course. Many thanks again, and now it's my great pleasure to give the floor of Her Excellency, the Ambassador of El Salvador, who is here with us also today to share about the interest of the country on CHAMPS. Please, the floor is yours.
Thank you. A very brief, but of course, on behalf of El Salvador, I would like to extend our gratitude to the United Nations Office on Drugs and Crime and its Prevention, Treatment, and Rehabilitation section for providing valuable information on the progress and scope of the CHAMPS initiative. In particular, we would like to commend your devoted dedication to address the use of drugs and other psychoactive substances, supporting children and youth in amplifying their resilience by creating this kind of services that is addressed to prevent this situation that in a very sadly way, I have to say, it's even bigger every day. So I also would like to say thank you so much for taking into account the importance to have this information, which is valuable, as I already said, in Spanish. I've heard that very soon in the website you will have information, updated information in Spanish, which I know that would be an asset to our countries, to our authorities to take a decision on this matter. In this regard, I would like to say that currently El Salvador is conducting formal discussions and internal consultations among national authorities to identify the key stakeholders and governmental entities that could potentially be involved in a future implementation process of the CHAMPS initiative in my country. This is a very broad initiative, and we do really would like to have the competent authority to do it in a very correct way, to be partners of you. That's why we are now doing internal consultations. We are confident that these consultations will provide very soon a clearer path forward, and we do really look forward to sharing with you, as well as other countries, our final decision on which national authority will be in charge to implement this excellent initiative. Once again, congratulations. Continue working in this area that we consider very important nowadays in the current situation in the world. So once again, many thanks. As well, I also thank you for your attention.
Thank you, Excellency, and I'm hopeful and trustful that we will meet your expectations, and I'm looking forward to very fruitful consultation where we can really move to work. And with this, I would like to move to our next speaker and start thinking also from the point of view of international collaboration at the very much global level. And I would like to call on our distinguished colleague, the delegate from France, to share with us some of their point of view. Do you need, okay.
Thank you. Thank you very much, Giovanna, and Your Excellencies. Good morning, colleagues. First of all, I would start to say that I'm very sorry for being late. I don't know why. I thought the meeting was at 10:30. But I am very pleased to have been invited to discuss on this CHAMPS meeting for two main reasons. And I will be very brief today. First of all, the first reason is because we believe as France that prevention is a very important axis of our action to our global approach to tackle the drugs phenomenon. We've been a key partner, I think, for the UNODC for many years on many programs. I can just say that we've been teaming up with the prevention branch on the Strong Families program in West Africa, and also a prevention program based in Ukraine right now. And we're also on the treatment aspect, I would say, one of countries joining the Scale Up initiative on the treatment of psychostimulants, which we believe is a big priority for us, as there is no treatment for this right now, and this is a real phenomenon in France as well. So this is the first thing. We're here because in our pledge last year, we said that prevention was important, and we believe we should do more on this area, even though our contributions are very limited. And second, because we've just recently joined the CHAMPS initiative. We've been adding a contribution, some top-up to the CHAMPS initiative a few weeks ago. This contribution will aim at helping the Egyptian government to develop the CHAMPS initiative. So it will develop psycho skills of children from birth to adolescence in the Al Asmarat area near Cairo. So that's why we're very pleased to be here with our partners, and we don't have much to say right now, but we would be very happy to discuss with all of you around the table to see how we can join forces on the development of CHAMPS, and we wish you a lot of success in this initiative. Thank you.
Thank you for the good wishes, but thank you also for the long-term partnership and support that indeed has made it possible for us to be here with you, in front of you, with a package that is integrated of evidence-based interventions that build on each other. This has not come out of thin air. It is the result of a lot of effort and partnership all around the world, including with the support of France, as the distinguished delegate was illustrating to us just now. And this is also illustrative of how we hope that the CHAMP initiative will flourish. All member states implementing CHAMPs, as I was mentioning, commit to really put their resources and their political will in creating a prevention system, at least in part of their territories, and then we in collaboration with us. And that's where we sometimes also need the support to be able to provide that technical assistance. And that's where countries like France come in to allow us to be of support to everybody else. And I think this is a wonderful way in which we hope to strengthen international collaboration on a thematic area that is of crucial importance to you all, as demonstrated also in the many parliamentary documentations and resolution that we have. And also going back to the distinguished delegate from Brazil, going forward also strengthen that South-South cooperation. So I think that will be a wonderful opportunity that we will create within the CHAMPS initiative. I mentioned parliamentary documentation and resolution, and Justice mentioned in his opening remark how it all started with a resolution. And there have been many resolutions in the past also paying attention to the need of prevention in general, the need of prevention among children and youth. But the resolution that we have in mind a couple of years ago that was sponsored by Slovenia originally, and that all of the CND, of course, endorsed, was the first time that shone the light on the importance of early prevention, and that gave us the impetus for this initiative. So it's my great pleasure to give the floor to the distinguished representative of Slovenia to share their commitment and their experience in this journey. Thank you.
Thank you very much, Giovanna. Distinguished colleagues, excellencies, ladies and gentlemen. I was very glad to hear the progress report on the CHAMPS initiative, and especially to see that more and more states are joining, supporting the initiative and sharing their experience. We can hear that prevention is becoming a focus of almost every meeting we go to, and most of the recommendations we hear are linked to prevention, which is evidence-based and not surprisingly cost-effective. Slovenia's commitment to public health approach thus made it only natural that when the concept of early prevention started to emerge, it got full attention back in Ljubljana. When early prevention emerged as an evidence-based approach that is proven to deliver positive results, we were already fully on board. Years of activity and tangible results culminated in the decision to table the resolution on early prevention with our French colleagues also, which was adopted at the CND by consensus and was co-sponsored by many of you. It puts in the front line the perspective of children and young ones and their rights to safe environment, education, and empowerment. We must raise our children to become free, independent, and resilient, and we must teach their parents and communities how to do that. The CHAMPS initiative, which focuses on comprehensive health and education interventions for young people, aligns perfectly with Slovenia's advocacy for early preventive measures. By targeting youth, CHAMPS addresses a critical demographic that is particularly vulnerable to substance use. We believe that this initiative will enhance the global framework for prevention by providing structured, evidence-based approaches that member states can adopt and adapt to their specific contexts. I much admire the dedication and commitment to this issue by the whole UNODC prevention team. We can all see what supporting, loving, and caring for children in early ages does to their self-esteem and their ability to make better choices later in life. And this is essentially what we try to do here, build a safety net for children, families, and community to secure a better, more resilient, and safer society that goes way beyond the issue of drugs. Let me just focus for a moment on programs that were initiated in Slovenia in the last year. In the end of 2023, a hospital treatment program for the adolescents with a mental disorder due to the use of psychoactive substances was established. This is an integrative and multidisciplinary treatment program for adolescents with mental and behavioral disorders due to psychoactive substance use. Slovenia has also introduced the Safe House program, which is aimed at women, illicit drug users who are victims of violence. Women users and their children can stay in the Safe House for up to 18 months. The program is run 24 hours a day and in a confidential location. To conclude, there is no easy fix and there are no fast solutions to the challenges we are facing today, but we are convinced that evidence-based prevention and early prevention will work in the long run. I believe that we as a society have a responsibility to work together hand in hand to protect our children and build a better future. I would like to thank specifically the states that already decided to become CHAMPS and those who aim to promote CHAMPS and ensure that this initiative is firmly going forward. Thank you.
Thank you. Thank you, Slovenia, for illustrating so nicely, sorry, this is not a great word, but the spirit that is behind this this initiative and what we all want for our children and youth. And thank you for being a champion, of course. And it's my great pleasure to invite the last delegation for today to share another delegation with which we have a long-standing partnership, including about developing and disseminating evidence-based tools for prevention. I would like to invite the distinguished delegate of the United States of America to take the floor. Yeah.
Thank you, Giovanna, Justice, and Wadi. I'm excited to be here today to support CHAMPS. First and foremost, I would like to express our deep appreciation for this vital program, as it represents a significant step forward in our collective efforts to prevent problematic drug use and promote the healthy development of children. The United States support for CHAMPS is driven by our unwavering commitment to address the synthetic drug crisis. As part of our synthetic drug strategy, we recognize the importance of evidence-based prevention, treatment, recovery, and rehabilitation as the continuum of care. So starting prevention interventions and building protective measures at a young age is crucial. Prevention is chronically underfunded, and CHAMPS offers a comprehensive strategy for municipalities and nations to identify gaps and opportunities in their prevention strategies. This allows for better targeting of limited resources to make a greater impact. Moreover, CHAMPS aligns with our commitment to the Sustainable Development Goals, particularly in ensuring the health and safe development of children. Every dollar spent on prevention is the equivalent of $10 spent on treatment. Investing in early prevention using evidence-based interventions in line with UNODC's prevention standards will result in better outcomes globally, resulting in a healthier and more prosperous community. For countries that may not be in the position to institute a systems-level approach like CHAMPS, there are still numerous evidence-based interventions and activities they can take advantage of as a standalone measure at no cost or with very little cost. Training such as the US-supported Universal Prevention Curriculum, or UPC training, the Introduction to Evidence-Based Prevention, or INEP Plus, and interventions such as Unplugged, as my colleague from France mentioned, Strong Families, are excellent examples of effective activities that can be implemented to enhance an existing prevention strategy. So following the US government's pledge for action at the most recent CND, the United States Department of State has dedicated over $40 million to support a range of international efforts to counter synthetic drugs, including support for CHAMPS. We are committed to leading by example and demonstrating the impact of multi-sectorial systems of prevention in changing the lives of children. And I would like to take this opportunity to encourage other countries to follow suit and engage with the CHAMPS program. By setting models of multi-sectorial systems of prevention and documenting the positive changes in children's lives, we can collectively make a significant impact. Finally, I urge more countries to support UNODC in pushing this initiative globally. Together, we can create a safer, healthier future for our children and our communities. Thank you.
Thank you so much, distinguished delegate of the United States of America, and not only by supporting in ideas and in example evidence-based prevention in your country and around the world, but also underlining the need of looking at prevention in a long-term perspective. Yes, prevention takes a while to bear fruit, and that is why sometimes in the face of a crisis, we have a knee-jerk reaction to try and stop the crisis, of course, and that is important, and that needs to take our priority. But also, we should always keep in mind about the need of thinking about the longer term and investing in creating environments so that this crisis, such as the synthetic crisis, but we have seen others, and hopefully we will see less thanks to the transformative power of evidence-based prevention. So thank you for that. And our last speaker is bearing also testament to the intention of CHAMPS to be an initiative that not only is transformative in the lives of children and youth worldwide, but also transformative in bringing us all together. We talked about different sectors. We talked about different kind of international cooperation. And I would like to give the floor to a representative of the civil society also to help us think and bring the collaboration between governmental agencies and civil society organization to life in the context of CHAMPS, and specifically a representative of the task force of the Declaration of Oviedo. You have the floor.
Thank you, Giovanna, UNODC delegates. I'm representing Proyecto Hombre, a civil society organization based in Spain, member of the VN-NGO Committee on Drugs, but today I'm acting as a messenger, speaking on behalf of nearly 2,600 organizations in 158 countries, including NGOs, networks, academia, but increasingly governments as well, that are supporting the Declaration of Oviedo, calling for strengthening and scaling up evidence-based prevention in drug policy at local, national and international level. Take it as an additional contribution, as another encouraging force rooted in society that is asking for more and better prevention, therefore sharing the spirit, the approach and the goals of CHAMPS initiative. In June last year, international experts met in Oviedo, Spain, to discuss on prevention, aligned with international scientific standards. From this consultation, over 200 experts draft 10 guiding proposals that you may find useful. We call for countries to allocate at least 25% of the drug demand reduction budget to prevention by 2030, 25%, targeting, of course, all ages of development, but favoring early prevention. It advocates for robust research and evaluation to avoid ineffective or even counterproductive interventions, while broadening prevention to focus on individuals, communities, and social determinants rather than just drugs. The intersectional approaches should be mainstreamed to reach at-risk populations and multi-stakeholders systems enhanced. Understanding prevention as a right for children and youth, so universal coverage through a continuum of care, embedding prevention hand in hand with treatment, rehabilitation, recovery, and other necessary strategies, with a special focus on low and middle-income countries. Finally, accountable monitoring to track the status and impact of prevention strategies in your countries. The full details, as well as the list of supporting organizations for each country, can be found at oviedodeclaration.org. oviedodeclaration.org. I also got some copies of the whole text of the declaration that you can download, and it's translated into more than 45 languages already, and the list of 162 country focal points, an informal network of organizations that we have set up to reinforce and promote these proposals. All in all, prevention is also essential to curb drug use in the long term, greatly welcoming CHAMPS. That is why we encourage member states, the Commission, and UNODC to prioritize discussions and forge joint commitments and agreements on science-based prevention at the next Commission on Narcotic Drugs sessions. Thank you so much.
Thank you so much, and I'm very, very much looking forward to collaborating with the more than 2,500, almost 600 organizations that have joined the Declaration of Oviedo, and I would encourage you to get to know the declaration and see how it is very much in line with all that and I say we, I'm not part of the commission. I'm at the service of the Commission on Narcotic Drugs, right? But we all that are in this room have been trying to promote for a long, long time in terms of expanding the reach of evidence-based prevention for the benefit of the health and well-being of everybody. This brings us to our question and answer session. It doesn't have to be a question. It could be more of a comment. Sometimes I can already see 2 delegations and 3. I'm very tempted to take my lead from our distinguished chair yesterday that was closing the speaking list so quickly. It was incredible. But please, I saw Italy, Mexico, and the Netherlands first, and then Burkina Faso. So for now, we have a little bit of a list, then we will see. Please, distinguished delegate.
Thank you very much, Joanna. Good morning, colleagues. Thank you, Justice and Wadi. I was afraid I could not attend this meeting because of the organization of the next one, but unfortunately, thanks to UNODC and my excellent team, everything is set for the next one, so I can be here. And I have one comment and one question. Very briefly, the comment is about our part of this project. As you may have heard, last Tuesday we pledged last year, and we enforced our pledge to support CHAMPS through through the development of a specific tool, which is the peer-to-peer part of the prevention. When we saw the table that you screened, it's the right part. I mean, how to do prevention with adolescents and pre-adolescents, and why peer-to-peer? I mean, anyone who is in contact with an adolescent, a teenager, or is young enough to remember how it was during the teens. They know that peer pressure at that age is extremely strong, and that in order to properly psychologically develop, the teenager tends not to listen to the authority. So that's why it's important to get in with peer-to-peer instruments and tools, but going beyond the anecdotal and personal experience, what is important when developing such tools is to be for them to be scientifically validated, and this is how the UNODC comes into place, and this is what UNODC has been doing. I participated in one of the meeting with the experts, and I can testimony the importance of this work of scientific validation with experts from all around the world, and with consultation with young people as well, to have a very good tool in place. So this was the comment, and then the question that comes from an experience that we are a problem that we are facing in Italy, and it's how to target one specific group at risk, which is minors in prisons. This is a particularly vulnerable group. I don't know if this is somehow taken into consideration in the approach of CHAMPS. So maybe we could develop this further in another occasion, but just as a need. Thank you very much.
Thank you so much. I'm looking at the time, and I'm cognizant also of the next event, like we were mentioning. So I think I will take all of the comments, questions. Then maybe I give you the floor, Vadi, so that you can wrap it all up, or I can also come in, whatever we prefer, and so that we can close. I have now Mexico. Sorry, I don't see you very well, but please, you have the floor.
Thank you very much, Giovanna. It's a comment. I will be brief. Thank you for the presentations for our colleagues, Algeria, Brazil, and others for sharing their national experience, but especially a very warm welcome to Egypt, to the CHAMPS family, given that CHAMPS is actually promoting a people-centered approach, which by extension is bringing the human rights dimension to the field of drugs. It's promoting collaboration, coordination with other agencies, UN agencies, including UN Women, UNICEF, World Food Program, and others, something that we favor a lot as Mexico. It's promoting partnerships with NGOs, academia, and the private sector, among other things. So very much welcome. We're looking forward to work together with Egypt in the upcoming CND session, of course, in promoting all these issues, and especially we're counting with their support next week in New York for the adoption of the Omnibus Resolution, on all, which is reflecting on these issues, which have been embraced so warm-heartedly by Egypt. Thank you.
Thank you so much. Netherlands.
Thank you, Giovanna. And thanks for this very interesting meeting and all the people who introduced and shared their national experiences. We heard a lot about evidence base, and of course that's incredibly important to do some things that we know actually work. For the Netherlands, prevention is a very important part of our policy as well. We want to invest in it more as well. But we also want to know that what we are going to do works. And I have heard a couple of speakers mention monitoring and evaluation. That is an essential part of that. But I wonder how this is done, because I think it's very difficult to establish maybe the link between what we are doing in terms of prevention, especially in this very complex environment, and the effects, especially if we want to show the causal links between what we do and the effects. So how can we then establish that things actually work? What methods and what kind of evaluation methods can we use to do that? I think it's very important. And also the cost aspect. Prevention is indeed very much cost effective when you compare to treatment and certainly enforcement as well. But monitoring and evaluation can also be very expensive if you want to do it in a very rigorous way. So if I could have some reflections on that. Thank you.
Hitching to reply, but I am the moderator, so it's my great pleasure to give the floor to our distinguished colleague from Burkina Faso.
Thank you very much. Yeah. No, you're welcome. I am your colleague, no worries. We are together. You said CHAMPS is a family, so I'm part of the family. You are my sister. Yes. Yeah, thank you very much for having us. This is the second briefing I'm having on the CHAMPS initiative. I'm always learning. I'm in the learning process. And I would like to also inform of the intention of Burkina Faso to join the CHAMPS initiatives. And as you know, we are in a geographical, cultural, economical, political area where everything, any methodology on CHAMPS will work on Burkina Faso, including the larger Western Africa and the Northern Africa. I mean, so I'm very happy to see already that some countries, Egypt, Algeria, Brazil, South of Cooperation is mentioned here, and all the supporting partners committing to continue that joining hands together. So you can count on us. Thank you very much.
Thank you, Excellency, and well noted. We'll catch you, if not immediately after this event, very, very soon. And it will be great to enter into consultation with your colleagues in the capital as well. Thank you so much. But did you want to come in on the two questions? Do you want me to go?
Just to be brief, I mean, just yes, in terms of new programs being implemented, these are key things, and this is where we recognize Italy for like the Friends in Focus. This is a program that actually, as I said, implicate children in the actual program and not being also recipients of the programming. So this is something we will continue developing moving forward. With regards to the person-centered approach that was mentioned by Mexico, this is something key in terms of the feature of the work moving forward, and we will replicate it across all models that will be implemented in CHAMPS. With regards to the protocols in terms of evaluation protocols that was asked by Netherlands, I think there are two key products that will be produced. There's the evaluation in terms of the evaluation of what exists in terms of services that we have demonstrated. And in terms of the application in Norway, we're currently moving it in this REPS model in terms of replicating it in Ireland as we speak. But you know, that mapping out of service, evaluating what exists and how much does it cope with the standards and how much cooperation there are, is a component of evaluation put in place. But the other component is the evaluation at systems level. Protocols will be developed based on every single country's system and priority needs. They are put in place. And Burkina Faso, yes, I mean, we would engage as well. We have lots of prevention activities coming in as unisectoral that would like to brief you on, Madam Ambassador, but eventually it has to come as a system. Hopefully it will be a good model. But given that I have the floor for 1 second, I would just like to recognize the fact that I'm sitting here on behalf of a team of lots of people working on prevention. I'm just, it's not only me to take the credit, but I would like to first recognize as well, especially within the team, Ali, who's been key in terms of pushing a lot of the activities moving forward. I move the floor back to you, Giovanna. Thank you.
Thank you, Vadi. I just want to add, going back to the question from our distinguished colleague from Italy, we have a tool in the red row at the bottom of the framework. There is recognition of the fact that, especially in older adolescents, there will be children, because they are under the age of 18, that may have started to use or may have gotten in contact with the criminal justice system, even to the point of being in prison. And that's where we have psychosocial tools that have been found to be effective in addressing a range of problematic behaviors, to get often together with the families, that have been developed in that gray zone between prevention and treatment. And we have them at the disposal of everybody, of course, and they will be integrated in the implementation of CHAMPS. I see movement at the back of the room, and I know there is time for closing. So let me take a couple of more minutes. I need to thank you all, of course, for being here throughout all of this briefing, and particularly the member states that not only have shared with us their experience, but have of joining this transformative initiative, but I'm hoping have been of inspiration to either join or support to fellow member states and or civil society organizations. So that thank you from us and the entire team from the bottom of our heart, and we are looking forward of having more of these briefs where we will come back to you with actual example of implementation, maybe some challenges, but also many successes, and especially for the health of children and youth. And before we go, let me invite you on behalf of the event that will follow in this room, all of you, to remain in the room for the high-level event that will commemorate the very first inaugural International Day for the Prevention of and Fight Against All Forms of Transnational Organized Crimes. It will start at 11:30 interminutes or so, will be 1 hour. And no spoilers, but the event will be moderated by the director of our Division for Treaty Affairs, Mr. John Brandolino, and will feature distinguished speakers, including permanent representative of Ghana, Honduras, Italy, and Slovakia, as well as the chair of the Alliance of NGOs on Crime Prevention and Criminal Justice. So I hope to see you all there as well. And thank you again, and looking forward to working together in the future for a while. Bye.